Hello everybody and welcome back. This is Dr. Mridula V. Amarnath here. So I know this phase when you've gone through your pregnancy phase and then now you've got a baby is extremely, very delightful experience. Probably every day is a new learning for both the parents and everybody around the kid. Every day you learn something new from the baby shows you something different, some new miracle every single day, right? It's a very pleasant and enjoyable experience, but at the same time it is stressful. Don't you agree with me? Yes, it is quite stressful because at times you do not know. If you're a new first time parent, you're not sure whether is this right, is this wrong, is it okay to do it that way, or you have a lot of queries. Well, I did, even though being a doctor myself, I did have a lot of queries, and after that I had to read a lot of things about it, more in detail. So I thought probably why not share with you some of the things which I had when I was pregnant, and probably a lot of mothers have asked me these questions. So I'm going to share with you 5 questions today so that you can go through them and probably make your mind a little more peaceful and things a little more clearer. Okay. So the first question for my today's question answer series is, one of the parent asked me, Doctor, I feel that my newborn's legs are quite bent. Is it normal? Is it something that I have to be really worried about? I'm sure you would not have noticed it. Probably someone in your family member, when they have come to your house to have a look at the baby, would have said, oh no, the baby's legs looks a little bent. Is it normal? So probably after they go, you must have also noticed it. Oh yeah, is the baby's legs bent? Is it normal? And then you would be, worried. Oh my God, now what is going to happen? Well, let me tell you, it is absolutely normal. The legs of most babies appear bent, though this does not indicate any disease of the bones or any sort of a deficiency. The natural shape of the calf muscles are such that there is more muscle mass on the outer side of the calf bones as compared to the inner side or on the side of the shin of the leg. Probably even in adults, if you see, the shin bone can easily be felt through the skin. So as a result of this uneven distribution of muscle mass over the shin bones, most of the children's legs appear to be bent. Probably if you do an x-ray, just by satisfaction, you would see that the bones are absolutely straight and there is no deformity. Now in case if it is severely bent and there is some sort of a deformity, then it could be because some bone disease or some sort of a deficiency. In that case, your doctor would certainly advise you to do another couple of tests. But otherwise, slight bowing of their legs or slight bending of their legs is absolutely normal. So the next question is, should I cut my newborn's nails? Well, this is another common question a lot of mothers have asked me when they come with their babies. Well, you must have also noticed that your baby's nails, they grow really fast and they're pretty sharp rather, okay? And it is very natural that, a lot of scratches are seen on their face because they keep, using their fingers to fidgeting their face. So a lot of scratches are seen on their face and you do not want that to happen, right? So baby's nails have to be cut. But in olden days, I think they were told that, it is not good to cut your baby's nails with scissors. I'm not sure why. So most of the mothers would actually bite off their nails. I don't think you really need to follow that practice. The nails of the baby can be trimmed by the mother with the help of small curved baby scissors that are available commercially these days. So I would say while you're cutting your baby's nails, be extremely gentle because make sure you don't go too deep and do not damage their skin. Okay, and make sure you cut their nails when they are fast asleep and put them on your lap and then gently cut their nails. But you need to cut their nails. So the next question was, a very concerned parent asked me, so I thought I should actually address this question because many of you might not know. So the question was, my newborn girl, I have noticed that she is having a little discharge and even a little blood-stained discharge from the vagina. Is it normal? Well, there is nothing to be worried about in the first place. So why does this happen? So when the baby is in the mother's womb, there is a lot of hormones which circulates in the mother, which also circulates in the baby. So once the baby is born, what happens is there's a sudden drop in these hormones. So as a result of this withdrawal of these hormones, you will notice this sort of a blood-stained discharge from the baby's vagina. You could just compare it with what happens during our menstrual cycles, right? There is a peak in the hormones and then suddenly it drops down, and that is when we also start having our normal regular menstrual cycle. So it is something in a mini version of that in our female babies. Okay, so parents do not worry about it. Probably it will just stay there for 3 to 4 days. Just make sure that area is completely clean and do not worry, it will not recur. Okay, so stay safe and do not be worried about it. Next question. My baby is losing hair. Now should I be really concerned about it? Should I start using any medications or creams? So all the hair that the baby has on the baby's scalp and on the baby's body is supported by the mother's hormones. Okay, so once the baby is out of the mother's womb, there is a deterioration in the hormones, right? So as a result, there is a loss of hair on the baby's scalp as well as on the body. I'm sure most of the parents wouldn't mind when there is the excessive hair which is on the body starts growing off. But on the scalp, when you notice that, it kind of makes you a little worried. In fact, for most of the kid it happens. The soft, fragile hair is replaced by a thick sort of a hair on their scalp. And for some kids, what happens is the growth, the hair fall and the hair growth is not matched. For some kids, what happens is as soon as there is hair fall, there is simultaneously growth of the new hair, and you do not distinguishly are not able to notice the difference, where the child is getting bald. But for some kids, what happens is as the hair falls off, it remains so for a couple of months, and then eventually the new hair starts growing, but very slowly. So during this period, a lot of mothers worry. Why is my child bald? Is he going to be that way for the rest of his life? Do not worry. The hair fall or the excessive hair which you see initially on their body is basically as an influence of the maternal hormones, which will, once the baby is out, the hormones will start coming down, and as a result you will also notice hair fall. But let me tell you, please do not try any oils, creams, medications to make sure that there is more hair growth. This will certainly cause more damage to your baby. It is a very natural process. Their hair will grow. Trust me. So the next question is, my baby has a lot of skin rashes, my newborn baby. Now is it normal? Should I be concerned? In the first month, or probably you could say the first 2 months, the baby's skin is extremely soft, sensitive and very delicate. And I would say majority of the babies, they have some sort of a skin rash or skin infections. Okay, it is very rare that if a baby passes through these first 2 months without any sort of a skin infection. Probably the commonest forms or type of rash in an infant are redness, boils, peeling of the skin, dryness, oiliness, diaper rash, mechanical or fungal involvement of closed areas like neck and groin, pustules, pigmentations and change in the skin color. So generally, I would say for most of the kids, when they're in the first 2 months, these skin infections can be easily cured or easily treated by either avoiding an oil massage or applying a moisturizing cream, or probably you could even use an antifungal or antibiotic cream or powder on those particular areas. But let me tell you, it can also lead to some sort of a serious infection. So any skin infection, if you think it is there for quite some period and if it is just increasing, aggravating, then it is better that you should consult your doctor. But otherwise, there is nothing to be worried, especially in the first 2 months, after the baby is born. It is an extremely common condition.